Hello, welcome to e-Governance Academy Digital Transformation Talks. I'm Hannes Astok, I'm Executive Director of e-Governance Academy, and e-Governance Academy is a non-profit consultancy organization focusing on digital transformation issues, and we work closely with the governments in all continents. The Digital Transformation Talks is a series of timely online discussions organized by e-Governance Academy. This event is organized in close collaboration with the Estonian Government Office. We are living in a weird world. In every government, business and family globally, we all are discussing COVID-19 pandemic and vaccination, vaccines quality and antibodies levels. It looks to be a new normality. The COVID-19 pandemic has also created a new reality for the healthcare sector, globally testing its limits. Last week, European Commission unveiled its common approach to vaccine certificates to ease free travel within the bloc. This announcement comes after tourism-reliant member states and industry players like the International Air Transport Organization has urged the EU to establish a form of vaccination proof ahead of a summer holiday season. The European Union is proposing a digital green certificate, and it will be possibly contain vaccination, testing, and recovery data. The digital green certificate can become a significant step towards interoperable COVID-19 proofs in Europe and can help governments to reopen societies and economies globally. Those in support of a vaccine certificates believe that it could ease travel restrictions and reinvigorate a damaged air travel sector. Opponents, however, see plenty of ethical and legal contradictions. To keep up with the debate, e-Governance Academy is organizing today's online discussion titled Digital Health Security and Vaccine Certificate. It's the first talk of our Digital Transformation Talk series. We do it because we at e-Governance Academy truly believe in a free and forward-looking discussion on digital transformation topics. In today's digital health security and vaccine passport discussion, we aim to cast a light on the following questions. What are the challenges and opportunities for the cross-border health data exchange? How can one country trust health data from another country? Who are the main stakeholders in the vaccine certificate development? What legislative and technical measures will be required for the international acceptance? What is the role of governments in developing vaccine certificates? And also, what is the role of the European Union or other cross-national organizations in providing cybersecurity guidance and facilitating information exchange between countries? And also, those questions are relevant for further trans-border medical data movement in more traditional medical cases. To be successful with a digital vaccine certificate, the world requires a solution that strikes a balance between verifying that an individual has been truly and effectively vaccinated and respecting at the same time digital responsibility and individual privacy rights. And again, for the credible future digital health solution, we need people to understand both medical and cybersecurity challenges. We have invited today excellent international speakers and moderators for today's event, and really thankful for them for joining us. There is already 100 participants attending today's event already, and many more are joining currently. We hope you to enjoy the digital transformation talk today and have some good takeaways for your country also. And now I'm glad to present our first speaker, Mr. Kalle Killer, who is Undersecretary for e-Health and Innovation in the Estonian Ministry of Social Affairs.
Dear ladies and gentlemen, good afternoon. My name is Kalle Killer, and I'm working in the Ministry of Social Affairs as Deputy Secretary General for e-Services and Innovation. Therefore, this topic of today is very close to my heart. And I am sure that the timing of these discussions is perfect. You see that there is a sense of urgency in all of the countries and their leaders in order to get our lives going again in this new normality. And digitalization of vaccines, or as EU calls it, a green certificate, is clearly one of the digital tool that helps our lives to get as normal as possible back again. So how should we do it, and what should be the aim of this digital certificates? If we look back at the history of exchanging cross-border information, then it has been very difficult. There are few countries who are sort of enough front runners, and then there are many countries who are struggling to get the cross-border information going. And I believe that today it's a perfect opportunity to actually take this forward. And I'm not only saying that it should be only vaccination. I believe that the sense of urgency opens up a lot more opportunities for cross-border data exchange. And I believe that we should aim higher, and then we should make the data and the exchange of data as part of our everyday activities. And by doing it safely, and respecting the privacy of our citizens, then we will be successful. If we think about how it is going to happen, then clearly we see again different speeds between the countries. Some countries are willing to move forward quickly, as Estonia. We are planning to have our certificates ready in April, together with our partner Guardtime. And then there are some countries who are more hesitant, and some countries whose technological background is not ready enough in order to share countrywide information. So clearly there will be differences. And differences also on what solutions are going to be used. I believe that there will be a number of solutions at the beginning with the countries who wish to move forward quicker, and then there are long-term projects in data exchange. For example, WHO project in order to exchange health information focusing on vaccination throughout the world. This is a long-term project, but I believe with the right cornerstones in place, that Estonia is also helping the WHO, this is possible as well, but it takes years. Of course, it's not one-off stop. It goes with pilots. It goes with scaling up, and then eventually, I'm quite sure that this is doable in the world as well. How can we actually do it? And there, I think it's very important to highlight that today we still don't have clear understanding and agreement on the use cases of this data exchange. And some countries are more conservative when it comes to the use cases of vaccination certificates, and some are more brave. But I think what is important that for our citizens, we should be able to give digital information into their hands in order to help them through in different stages of the traveling or everyday life. And no matter of the use cases with this digital information, people can get along much better than it is now with all the paper formats, different standards, and of course not able to prove that actually this information is correct. And I think this is one of the key when it comes to the digitalization of certificates, that we are able to prove that this information is correct, that the person is presenting. And in addition, this information is securely handled via different counterparts. So I think I am stressing a lot the privacy and security concerns, but I think this is one of the key also when it comes to the gaining the trust of our citizens when implementing such tools. Secondly, can we do it? It is very much dependent on the success stories. We have to have success stories. And I mean by success stories that, first of all, there are sufficient amount of technologies available to do this. And secondly, that there are countries who are willing to lead the way and actually show that this can be done using the information that is in our hands. And if there is a critical mass of countries who are able to exchange such information and are willing to embrace that this technology should be used, then it's a matter of time that when it scales up to the other countries as well. So I wish you a very good discussion today, and I'm looking forward to the results of our discussion, because such a good presentation of experts that are discussing today this issue is definitely a good input for us as well in order to develop best possible tools for future. Thank you very much and have a good discussion.
Welcome to today's event. I am Merle Maigre from the e-Governance Academy, and today we are going to talk about digital health, data security and the vaccine certificate. Many thanks to Hannes Astok, the e-Governance Academy Executive Director, for the opening words. Many thanks to Kalle Killer, the Undersecretary for e-Health and Innovation at the Ministry of Social Affairs of Estonia, for his keynote, setting the scene for our discussion. I very much agree, aiming high with the digital vaccine certificate and data exchange is important. And I think it's great to hear that Estonia is planning to have the digital vaccine certificate already ready in April, together with GuardTime. Today's event is part of the Digital Transformation Talks series of e-Governance Academy. We are going to have two roughly 45-50-minute sessions. The first one will be focusing on the challenges and opportunities of the cross-border data exchange. And then after a really short break, we shall continue the discussion focusing on how to raise trust towards the vaccine certificate in the second session. It's exciting to know that we have so many viewers. I'm really excited to have with us so many good experts. But before we start with the discussion, let me introduce you to today's event environment. We are using an event platform called WorksUp, where you can ask questions by clicking on the Q&A button under both discussion sessions. I really encourage you to do that because I'm certain that many of you have many good questions. If you do not have a question of your own, you can ask. I would ask you to upvote other people's questions. The ones that are most upvoted have the highest chance of being asked. So be sure to do that. But now let's discuss with our first discussion titled Challenges and Opportunities of Cross-Border Health Data Exchange, where we have Terje Peetso, member of the Management Board of the North Estonia Medical Center, Marten Kaevats from the Government Office of Estonia, and Clayton Hamilton, Coordinator, Digital Health Flagship, the World Health Organization Regional Office for Europe. Terje, the floor is yours first.
Hello, good afternoon, everybody, and many thanks for the invitation and the opportunity to share as well as learn. As said, I'm representing here the biggest hospital in Estonia, the North Estonia Medical Center. The name center sometimes confuses some people as it is the center. In fact, it's the hospital. It's the big hospital. It's the biggest, as I said. And we are dealing with almost all aspects of healthcare, including the contagious diseases, including the work with COVID-19, including the vaccination. And as you know, it is the big issue for our healthcare system right now at this moment. But I'll tell you about the opportunities and challenges that the exchange of health data would bring. In fact, I would change the title of this session to Opportunities First, and then we will see what the challenges are, because I personally see a lot of opportunities in this process. I am absolutely convinced that the exchange of health data, access to data, quality of data, all these aspects of health data, that is that could bring the similar jump in healthcare as in last century we had when we started using antibiotics, or a century before we started to do the vaccination, or at the time when we realized that what is the importance of clear water. So I think that these health data use analytics really bringing it into the research and understanding, helping people with rare diseases or complex diseases would make the really qualitative change. In my first slide, I am I tried to bring together all the opportunities, all the sources of health data that we have. What we unfortunately, however, don't use all of it, because if you go around the clock, then I would say that at 12, the data that I collect myself, we very rarely use nowadays in our services. Yes, we ask for this information. Of course, the subjective view of the patient is the incremental part of any health record, but the factual data from all kinds of applications or the monitors, we do not necessarily involve in our work. So is the information from telemonitoring, which is also not as widely used as we can. Also, I would say that we are doing a good progress in it, and I'm very happy to say that our health insurance fund is really supporting this approach, and otherwise in this COVID period we couldn't. So that's what was an innovation, looks to become a norm nowadays. And also where we have almost no use of this information that is available is the source of loyalty cards, because people have a lot of information about their lifestyles behind this information, where the owners of these loyalty cards have this information. However, the healthcare system, the GP or the family nurse or your specialist who is treating your chronic condition does not have this information. However, bringing this all together, I would say, would add enormous valuable information to your health status, as well as prognosis and the treatment plans that you may have. All other good sources of information, such as e-prescription database in Estonia, where we can not only see what has been prescribed, but also what has been purchased, and we can also see we have a link to the database where we can see whether the prescribed medicine has any contraindications with other prescribed medicines. We have quite well established the electronic health records. However, they don't talk to each other. We have not agreed with all these interoperability criteria that would help us to bring together a good database involving all Estonian patients. Which is actually quite remarkable in that sense, because it's 1.3 million. From another hand, in one single hospital, where we annually treat approximately 150,000 single patients, that almost 500,000 visits. However, that compared to other big databases worldwide available is quite small. In that sense, electronic health records and the research data, both from clinical trials or the academic research, that all together in the European health data space, that would be something. And I think that if we don't have it, then we will just lose an opportunity. My next slide is exactly describing this order of as I see it, it's the opportunities. First of all, what is that we see as the valuable output from what we are looking for from health data? I think that a good example here is the European reference networks, where we can already now share information about the patients with rare or complex diseases. And that very clearly illustrates the need and an opportunity. We have this opportunity and it works. And when you speak to people with rare diseases, you feel this support that they have and the way they can overcome the obstacles with the goodwill sometimes. Not necessarily the technical or legal solutions involved, but that is the real need for it. I think we could, from this health data exchange, improve the quality of our treatment, because we could have the comparison with other hospitals and we could learn from there what is that they are doing differently in order to achieve these results. We could do much better research because sometimes we just don't have enough patients for this or another type of study, for clinical trials, for specific medicines. Now, when we are talking about personalized medicine, I think that we should really focus on the bigger scale studies, while we can combine the patients from different countries, as well as the academic work and other clinical studies, where sometimes the hypothesis needs to be tested in other clinical settings and in more than one country. And that would all contribute to better evidence-based guidelines, which are the necessity in every specialty that we have in medicine. So that these are the opportunities that are easily achievable if we would meet or overcome the challenges that we are facing. We have to agree the objectives of what is the purpose of sharing this information. If we take into account the opportunities that I listed before, having the research, the secondary use of data all together, that is already the objective good enough to work towards it. If we agree on the quality of data, that we agree on what is that we collect and in which format and who does the check for the verification of the quality of data. I think that is also something that we are working on. We should work on this together, and that would bring us the results where we do not necessarily have to talk about the quantity of data that would bring us the correct results. We can, with the quality of data, we can really count on less data necessary. Interoperability issues, I think that we have been talking about that for many years. Some improvements have been made. We have the European standards which are recommended for the use. However, with the semantics, we haven't moved forward, and that is sometimes when I am very proud about the Europe, but at the same time that brings the problems with this language that we use describing the patient case. And how do we, what kind of data we use for the laboratory, radiology, pathology, and how it all to bring together, that may be a problem, but I am absolutely sure we can overcome it. We can scale things, we can use the tables with numbers when we have agreed what is behind that, and that is possible even if we speak the different languages. And of course, organizational, because when I spoke about the quality of healthcare services, then of course you have to have an organizational agreement that comparison is beneficial for everybody, the patients, the healthcare providers, the policymakers, those who do planning, those who spend money. And that is something that we have to have the cultural agreement. And of course, you cannot not speak about the data protection and cybersecurity, but that is something that is legally binding. However, on data protection, we have some differences between the member states, and that's what the General Data Protection Regulation allows us. But I hope that with the agreed objectives and agreed the quality criteria, and when we have met all the interoperability requirements, we can also overcome this challenge quite easily. That would be briefly from me, and really looking forward if anybody has any questions.
Thank you. Thank you very much for this really insightful and well-structured perspective of the healthcare provider. I would now ask Martin Kaevats from the perspective of the government, from the Government Office of Estonia, to tell his views, share your views. Martin, the floor is yours.
Hello, everybody. Thank you for having me here, and thank you very much, Terje, for this very pragmatic and practical intro. I will try to give a bit of a helicopter view to this whole subject, because as the National Digital Advisor for the Government of Estonia and responsible for everything digital and innovation related in this small country of 1.3 million people, I'm also working together with the World Health Organization as a member of the Digital Health Technical Advisory Group. And since 2019 October, I was kind of given the mandate to investigate health data interoperability on a global level. And well, this is a bit more on the higher level side. So, and some of those nuances that Terje was talking about are critical. But again, I'm a bit looking at the whole picture from a kind of a bird's eye or a helicopter view. So in the global scene today, there is lack of any basic trust. Like the pandemic, which I would argue is one of the best exercises of individual responsibility in our lifetimes, and probably in our parents' lifetimes as well. There's a lack of trust, and lack of trust in very, very, very basic things. So when in 2019, the WHO CIO and the Digital Health Technical Advisory Group, we started investigating the cases for health data interoperability, again on a high level. And the point was that when we are building trust, we need to do it in a way that can be utilized in many different use cases. So there were several workshops that were undertaken in Geneva pre-pandemic, and again, something like 3 weeks before WHO announced the pandemic, the WHO also presented the case for the yellow vaccination card, the point which we now call vaccination certificates, and how to augment it or enhance it digitally. But in this whole picture, we need to acknowledge a couple of things. And more or less, since then, the government of Estonia has been really in the epicenter of these discussions, been working together both with the WHO and the EU in trying to figure this thing out. But there are few notes or ideas that are critical here. As mentioned, the pandemic is an exercise on globally in individual responsibility. There are many people that are actually staying home now and not going outside, and they are practicing this responsibility. And similar type of responsibility and trust needs to be established between the member states, because and we're not talking about those advanced use cases that more or less Terje was mentioning currently, but we're talking about some very baseline things. And one of those things is that, ironically, there is no organization on this planet that knows the names of all of the different hospitals in the world. Like, for example, Terje is from the North Estonian Medical Center, which in Estonia is the acronym is called PERH. Then most people, we here know it because it is the biggest hospital, but most people, like, I don't know, the Cambodian border guard not necessarily knows what PERH is. Or how many hospitals do you guys know in UK or in Vietnam? Maybe some, but not necessarily all of the 1,000 different healthcare providers in Estonia, for example. And while we are working, and the WHO is also working actively on figuring out the global trust framework that is necessary for the deployment of the smart vaccination certificates. The current scene is that each of those governments and countries, they are deploying various different technologies, and these need to meet certain standards and minimum viable data sets. And I'm pretty sure Clayton and later on Konstantin will explain the work done in agreeing those standards and minimum viable data sets. But still, I think it's a case that the trust framework is an integral part of this. And as mentioned by Terje also is that, and Terje and Kalle as well, but we should aim higher. We should try to do more, because currently what I see, and being intimately part of those discussions in the epicenter, then in certain points, the technical and the engineering know-how has surpassed the domain and know-how, which basically means that if we are about to build first global trust framework for health data that aims to would like to aim to those things that Terje was mentioning, then perhaps we should think further. And for those experts also is like, the point is that the architecture needs to be fast enough. I acknowledge that what Kalle Killar was saying, that this is a long process, and those health data experts and standards experts, you probably all know it, that these are long discussions about taxonomy and classificators and whatnot. But we should build the system in a scalable way. And by scalable way, I mean in a way that, because I don't necessarily mean that it should scale to the world. Of course it does, because this is like a basic hygiene issue. But it should scale to other use cases as well, so that these other potentials of evidence-based guidelines or personalized medicine across the borders, or digital prescriptions on a global level, or any other health data use case that needs to cross the border could be facilitated by the WHO. And the works currently are ongoing. There are issues there, and there is also talk. Last Friday, the WHO Smart Vaccination Working Group published their interim report on the guidelines and the idea on how to get this done. Their current suggestion of running a global PKD architecture, sorry for the technical term, does not necessarily meet those demands. So work is ongoing. Estonian government is contributing to it at the very core of it. We are trying to help our colleagues and friends from the World Health Organization to understand and then aim a bit higher, not only do this very narrow thing of solving the problem of vaccination certificates. So I'm pretty sure that the next weeks will bring more news and developments. But again, happy to be part of this global discussion and contributing with the community and the expertise and the know-how from all of the Estonian community. Thank you.
Thank you. Thank you, Martin, for walking us through the Estonian government activities and contribution into this big, great thing. Clayton Hamilton from the World Health Organization. Martin referred to a report that came out just last week. Can you tell us more about that and more generally the World Health Organization's views and perspectives on the issue?
Yes, thank you very much. And firstly, thank you very much to the organisers for this session, which I think is really timely and really important to actually draw out some of the issues. So what I'd like to do, drawing upon the perspectives that Terje and Martin have presented, is to really just very briefly touch upon some of the more generic challenges and opportunities of cross-border data exchange, and then go a little bit more into the smart vaccination certificate work that WHO and its partners have kicked off. So firstly, really just to reflect for a minute or two on the impact that COVID-19 has had. And I think we all agree that it's really exposed, in particular, a number of inequities and inabilities of health systems to actually respond effectively. When we look at this from the WHO's perspective, we've seen quite consistently that countries have struggled to have the ability to have basic access to real-time or near real-time data, including not only accessing it, but an inability to understand how it can be used and leveraged effectively. Now, this is despite the fact that WHO for some time has been emphasising the importance of national health information systems. And really, it's probably the lack of our ability to utilise the data which even exists is one of the most significant shortcomings of the pandemic. Now, given also that, as we've seen, infectious diseases don't respect national borders, it really is rather ironic that in 2019, when the pandemic came into being, surrounded by many of the technologies and the data that we have, that we really haven't been able to leverage it in a way, either nationally or cross-border, that could have prevented the increase in morbidity and mortality that's ensued, and the protracted lockdowns, which we all continue to experience. So in that respect, as Kalle had mentioned in the beginning, sometimes at the national level, the use cases for the exchange of data can be somewhat unclear. Well, certainly now the international use case for the exchange of data is crystal clear. And countries and health authorities recognise that now better than ever. So in a way, there is actually a silver lining to the pandemic, as we've all experienced. We also have to take into account, beyond the lessons learned from COVID-19, to look, as Martin was saying, really further beyond, and how we can leverage the benefits of digitalisation data to improve the resilience of health systems and the availability of health services and data. And sometimes it's really the case that within particularly European Union countries, that we maybe even take for granted some of the digital services and data that are available to us. And we should recognise also that's not the case in all the countries. In the 53 countries in our European region, which take into account the Balkan countries and the right across to the Central Asian republics, it's a completely different environment. So we have to respect that not everyone is on the same level of digital development. And that, again, makes it a little bit more nuanced in how we actually look to cross-border data exchange. So if we look to the benefits of what there are, now there's some really obvious benefits of cross-border data exchange in terms of provision of services, in terms of continuity of care, and in terms of public health action. But I think the real value will come in terms of being able to gain insight by combining large data sets across national borders, and to apply it to develop new insights to move away from health systems which are largely reactionary. So we don't get to individuals until they present themselves as having a disease or infirmity. So we want to change that paradigm to a more preventative health paradigm, and we believe that data really has a key role in doing that. It's also a really important part for health system sustainability. So we know the cost of health is generally increasing, health systems are struggling to keep up, and we need to utilize the data and digital tools at our access in order to actually ensure the sustainability and the equity in access to health services for populations. Now, interoperability is not new, as Terry had mentioned, and the European Commission has actually had its interoperability framework around since 2015. And what this actually does is recognize interoperability as a combination of legal, organizational, semantic, and technical constructs. So in essence, we know what cross-border interoperability involves, but it's still a very difficult lift, as Martin was saying, to really try and push this further along. So a lot needs to be done in national parliaments to have agreement at the technical level, at the organizational level, and for all of those things to come together to really do it. So I just wanted to touch upon equity also. So not everyone has access to digital solutions to the same extent, and COVID-19 has exposed a large number of socioeconomic inequities, but also digital inequities. So we really, from WHO's perspective, have to strive to make sure that we don't simply transplant those socioeconomic issues into digital environments. Now, to cross to the smart vaccination certificate, so we all know that this is gaining rapid interest by many countries to facilitate gradual and safe relaxation of public health and social measures. And governments and businesses, we know, are likely to require proof of vaccination from individuals as a condition for entry or participation, whether it be in domestic use cases or for international travel. It's important to point out that smart vaccination certificates are not an immunity passport. They don't have any record or inference of immunity of an individual, but they are simply a record of vaccination of a WHO-approved vaccine having taken place. And we in WHO only consider this within a health context, not to be used for other purposes such as foreign affairs or trade. We also need to take into account that currently, as it is here today, WHO does not recommend proof of COVID-19 vaccination as a condition for departure or entry for international travel. So when we talk about some of the impediments, we still know that there are legal instruments at the international level that we have to work to try and change in order to accept the digital solutions that we're developing. So the digital environment is really moving a lot quicker than the organizational or legal environments are. But again, that's something that we need to take into account. So at this point, countries are advised to take a risk-based approach to international travel in the context of COVID-19. So what benefits could smart vaccination certificates give us? Well, firstly, unlike their paper equivalents, they're significantly more complicated to forge. And we've already seen cases of forged COVID-19 vaccination certificates in a paper form circulating. They can support public health monitoring over and above a simple paper form. So, for example, they can help us report on adverse events following immunization. They, as Martin pointed out, can facilitate data sharing across systems and across national borders. And if need be, they can actually be revoked. So you can actually withdraw a certificate if there is an issue with a vaccine or if simply the vaccine validity as it's determined at the international level expires. So what's WHO doing about this? Well, right now, the Digital Health and Innovation Department in Geneva is leading a development of a standards-based certificate, so the standards itself, rather than a commercial product or any specific product, for cross-border use as a digital public health good. So technical colleagues from the European Commission, from all corners of the globe, are heavily engaged in helping us define those standards. And this will essentially be a consistent data representation, how certificates could potentially be exchanged across borders, how they're governed, privacy and security surrounding them, and as Martin also mentioned, a common trust framework across all types of users. WHO is taking a paper-first approach in terms of ensuring equity. So again, coming back to the fact that we know not everyone has a smartphone, not everyone can actually access digital solutions in the same way. We believe that going with a paper-first approach is really the best approach that we can. And there are two scenarios that we're adopting for this, and that is the first one is a proof of vaccination, so that a certificate can be presented as proof that the bearer has received a vaccine for COVID-19 and that this claim can be checked and validated by an interested party. The second is continuity of care scenario or use case, that a certificate can be presented to a medical authority nationally so that the bearer's vaccine status can be considered as part of continuing to provide care to an individual. So in this sense, it also forms part of a personal health record. So I won't go too much more into detail, but just to say that in order for this to work, then we really need to look to the technology of establishing a global digital trust framework that will allow these certificates issued by national authorities to be trusted across national borders. Now, again, we've all seen that we have financial transactions that go every second of every day across national borders. So why is this so difficult in a health context? Well, really, health has been for quite some time lagging, I think, in this area. But really, the pandemic has really caused a new impetus to try and help us bring this together. So the solutions will hang upon the establishment of this trust framework, which, without getting too technical again, could rely on a number of technical solutions, whether it be a public key infrastructure or another services-based infrastructure. WHO sees itself as having a mandate for holding the root or the guardianship of such a global trust framework. It won't hold any protected or personal information in this, but it will allow for that trust exchange, issuing and verification to take place. So last Friday, WHO released its first guidelines. It wasn't actually a report, it was a set of guidelines on developing smart vaccination certificate that has come from the global working groups, and there are 3 major working groups that have been working for months to develop release candidate one of these guidelines. They're available for everyone on the WHO.int website. And there's a period up until April now where we're opening for public consultation to help improve them. So they really are still in a very preliminary phase. But again, it's seen as being the first step up until around about the end of June, where we hope to finalize this and then be able to give them to countries in order to establish a standard for the data format, how the certificates are actually constructed, and their exchange. On top of this, then we will pilot a global digital trust framework that will allow us to set up and ensure that these certificates are actually capable to be exchanged. Now, there are a lot more issues around it, and even from WHO's perspective, it's still very new to us. So we're drawing upon the expertise globally to make sure that we actually are able to bring this together and do it in such a way that we ensure that everyone, irrespective of their national income level, their personal income level, are able to use these tools for both domestic and international use cases. I'll leave it there for the moment and happy to answer any questions that come up at a later time. Thank you so much.
Clayton Hamilton, thank you so much for walking us through and giving us a very rich overview of the World Health Organization's position on this. I think we've tried to pack it as nicely as possible into this short amount of panel time, starting from a specific, going to the more general, starting from the perspective of a caregiver or care provider, moving on to the government and then the international level. In trying to provoke you all into a bit of a discussion and asking some questions, Terje, I wanted to turn to you first. And again, excuse me for being a bit provocative. I really enjoyed your very clear set out of the opportunities and challenges. But let's face it, what we've seen through media over the past year in Estonia, in Europe and across the world about the situation in hospitals is pretty scary. Overload of patients, doctors under stress, and really, really worrisome scenes and pictures. This is not sustainable situation because clearly the COVID-19 virus will not be going away. It will stay with us, probably mutating. So my question to you, in this COVID situation, do you think the solutions to find out or to improve the situation that we are seeing in hospitals, does it lie in a possibility of various international stakeholders investing more into digital solutions? Or do you think the solutions are somewhere beyond digital? And what is the role of the hospitals themselves in all of this? What role can the hospitals take? If you could quickly tell what you think on this.
Yeah, well, I have to say that the situation cannot continue like this. That's not possible. We are currently, for example, in our hospital, reducing the planned treatment and all kind of planned procedures that people have to really wait longer. Either it is the surgical procedure or it is in any other type of investigation or the planned treatment. And that is not sustainable for sure. We cannot digitize COVID either. So that doesn't help here much. I strongly believe that if people would follow the rules and people would get vaccinated, that would help the situation. If it would be mutated, I'm sure that the vaccines will be adjusted accordingly. And this type of citizen responsibility is important. What digital can do in that context and what it has already done. And I am very grateful for this, because the science and the understanding of medicine, that is not isolated anywhere in the world now. Maybe North Korea. But in principle, the scientific knowledge that we have and that we gave through the experience is the information that provides us some tools in order to address the disease more effectively. I think we're doing already now better than we did a year ago, because we know more. And last spring, what helped, for example, Estonian hospitals to prepare for the pandemic was the knowledge that we received from colleagues who had already faced it. I think our doctors had the regular connection with the doctors from Italy, for example, to learn about the ways of treating in the ICU or the ways of treating people with rare diseases, or how to handle the patient with COVID and cardiac issues, or the COVID and oncology. I think that is all this type of information that we can get out from the database and the source of information, and that is the digital source of information. It has, of course, to have its quality and the proof of concept, etc., but it is accessible. I think as regards the patient and increase the responsibility in that context, that is also the quality of information. I think that here we are facing a lot with the same problem that Europe has had, or the world has had, as regards the vaccination and anti-vaccination movements, and how we can increase the knowledge with the science, and how we can improve the health literacy of people, which would bring this type of patient empowerment and the patient engagement and the citizen engagement. And again, what I'm repeating, this type of responsible behavior. That is what digital can do, because if people would be digitally literate, digitally health literate, then they can choose the source of information and they can verify the quality of this information, who is talking about what, and what is that this information you have to do with. Because literacy is not only reading and understanding, it is also about applying this knowledge. And that's why I think that the digital, in that sense, has also a good value. I'm not sure, I cannot really come up with any kind of percentage of how much it would contribute to have this vaccination passport. I think that it has another purpose of it. But in principle, in order to gain the sustainability in our hospitals, digital can do a lot. But I would say that this is far beyond the COVID. It is on each and every aspect, because I think that if we could facilitate the speed of the access to a service, or provide the teleservices, or we could provide the telemonitoring, or we would use the patient-reported outcome measures, which would help much faster to react on the changes or the trends. That would reduce unnecessary hospitalizations, that would increase the quality of life of people with chronic conditions. And all these elements involve digital. And overall, as I said, just understanding of the disease, that is coming through the data. And if this data are digital, they are good quality and accessible and analyzable. That is what we are looking for. And that is what is absolutely must for making this healthcare system sustainable. Absolutely.
Terje, thank you very much for making it so clear and putting it in so clear terms. You really are a star, and it's a pleasure to have you with us. I know that we are pressed with time and that there is not really as much time left for the discussion and questions as I'd like it. But I still want to squeeze in at least one question to you, Marten, in trying to provoke you a little bit. I mean, you are coming from the government level. Every crisis management needs political leadership. Yet all the political decisions will be applied and implemented at the level of the public service or administration by the officials. So what, on your opinion, is the role of politicians in this? Are they helpful? And how can and should they use better the public administration in finding solutions? So this relationship between the politicians and the public service, and how useful are politicians in all of this, in finding solutions?
I'll try to keep it short. I think, the role of politicians is fairly clear here. Take Jacqueline from New Zealand. She has been super crystal clear in communicating what needs to be done. And I would say still that the clear communication is the main objective of politicians in such a scenario. And the rest is basically the role of experts, because this is not the black and white scenario. There are likelihoods and maybes, and there's always a bit of lottery and gamble in this game. I think and still believe that we need to have leadership like New Zealand, like our neighbors in Finland, as Sanna, and to have a very clear message. To be constantly in a mixed message scenario, then that's the worst that can happen and has happened in many places.
Thank you. That's very clear. Thanks for that. All that we have time left now, I think, is to one last sort of like really flash round of all three of you, underlining perhaps one last important issue that you would like to stress. And Clayton, I would start from you, if you don't mind.
Sure. So one important factor, I think, the issue of trust came up, mentioned by Marten, and you don't go very far in such dialogues such as this without trust coming to the issue. I wanted to point out that the European Union's Agency for Human Rights in a survey last year pointed out that between 1 in 4 and 1 in 5 EU citizens don't trust sharing any of their personal data with governments at all. That goes well beyond health data. So we need to work harder in order to establish trust in the use of data. And I think, going back to the question of politicians, good policy, accountability and transparency is probably the key way forward. We need better data governance in order to be able to utilize more effectively the data we have for improving our health situations. And without it, I think we're going to have a circular discussion about trust for years to come. We need to act a lot faster in having that and understand what it really means to have data governance and understand what that impact is in developing public trust. Because the situation is now, citizens don't want to share their personal information with governments, but are freely doing so with the private sector for many solutions. So again, that would be my number one issue to try and tackle quickly.
Thank you. That's really wise. Terje, what would you have? What would you say for like one last thing? As a key takeaway?
That's actually not my wisdom. It actually comes from the European Patient Forum, who has the project called Data Saves Lives. That's what I want to say. Data saves lives. And if I would have a plea, then I would ask for really European Union, make this health data space happen and give funding for it.
Excellent. Thanks very much. Marten, last sort of like takeaway for us to leave us with.
So the quick takeaway, I'm pretty new to this health data space, and basically two things. I would like the World Health Organization to actually step up their game and actually start playing a role in digital health and data and the cross-border exchange of data, not only in the vaccination certificates use case. And also, just for the nerds listening out, because I know that the e-Governance Academy has the technological experts as well. The proposed PKD solutions that are being discussed is just not the adequate fit, and there is many arguments there. But let's continue those discussions in other rooms. Thank you.
Thank you all. Thank you all. It's been a real true pleasure of discussing these pertinent things with you, but the discussion does continue. I really enjoyed all of your insightful thoughts. We shall now break for a couple of minutes and then definitely stay tuned, because we shall gather again for the next session on how to raise trust towards the vaccine certificates. So don't leave us. Keep on asking questions at the workshop Q&A panel, and stay tuned.
Hello, good afternoon, good morning, good night. Wherever you are, I think we have a very international audience thanks to the fantastic international reach of the e-Governance Academy. My name is Paul Timmers, and I will be the moderator for this session on trust in vaccine certificates, where we will, I think, pick up actually where the previous panel left, because they ended talking about trust and communication. And we will certainly talk a lot about trust and vaccine certificates against the backdrop of some of the developments in Europe, in particular that at the European level, the European Commission has proposed a digital green certificate. But we are also very interested to discuss what is happening at the national level and internationally, like what is happening in the context of the World Health Organization. I'm pleased that we have a fantastic panel here that can walk us through some of the issues that have to do with vaccine certificates and trust. And in the panel, we have a representative of the department in the European Commission, DG Santé, that is heavily involved in developing the digital green certificate. That is Konstantin Hipponen. He's a policy officer at the European Commission. He's got a computer science PhD and has been the lead architect in Social Insurance Institute of Finland. We will then, after he has given a presentation, get a short presentation by Ain Avikso. Ain is the Chief Medical Officer of Gartime, a lecturer at Tallinn University in Estonia, and has a master's in public health from Harvard, and is also a medical doctor, like others we have had before in this event. And then finally, we will have an explanation by someone who's very much involved in this trust framework that has been mentioned before, the trust framework which is linked to the European proposal. That's Vincent van Pelt, a medical doctor and a software engineer, and senior advisor to NICTIS, which is the Dutch Organization for Digital Information Exchange in the field of health. So we'll have three speakers. Your moderator himself is associated to the University of Oxford, of course, moderating here in a personal capacity, and also professor at the European University in Cyprus. And I've been a former director at the European Commission and advisor on digital health and European health data space that was interestingly mentioned at the end of last session to the European Commission. Now, we have quite a challenging topic in front of us. And what is also quite interesting is that we kind of see here live policy making that has to happen in a situation of extreme pressure and very high expectations. So you cannot expect that all answers are known at this stage, but we will try to get a bit deeper, in particular about trust in vaccine certificates. Now, we will have these presentations, and then there's the opportunity also to discuss with our panelists, and also from your side as participants listening in, to raise questions. And if you are on the workshop side, you will see a Q&A button that you can use to enter your questions, and hopefully then they will ultimately be passing on here. So now I would like to give the floor to Konstantin Hipponen for your 7-8 minutes presentation. Konstantin, over to you.
Thank you very much, Paul, and good afternoon, everyone. It's afternoon, at least here in Brussels. So happy to be here, and many thanks for inviting. I'll share my screen so you could see a few slides. I will present shortly this proposal of the regulation on a digital green certificates and also the proposed technical architecture for the design of this solution. So the status quo in Europe is that we have COVID virus pretty much everywhere. A few countries are still green, Iceland and a part of Norway, and that is why member states have established a number of different restrictions requiring different types of medical certificates, test results, and so on, in order to prevent the further spread of the virus and its variants. However, there is no common approach to this, and what we also learned from, for example, representatives of travel industry is that, well, there could be, for example, 10 countries in the world which require or support the provision of vaccination certificates instead of, test results, for example, or being quarantined, but only 2 countries would use the same rules. So there is discrepancy in the approaches, and also we see that these restrictions imposed by member states, they are not fully in line with the basic free movement requirements. So there are a bit too much of the free movement restrictions. So and also one of the problems is that when citizens are providing these certificates, sometimes they are rejected, and this is of course not a nice surprise for the citizens. So what we see is that certificates are pretty much different, issued by different member states, and with 27 member states, we could see 27 types of certificates, different data fields, verification and authentication mechanisms, and so on. So we saw in the news also that some citizens were rejected, entry into member states because they could not provide a certificate in a suitable language, for example, while boarding the plane. So this is really not acceptable. That's why there is this proposal for the digital green certificate regulation, and its main principle and goal is to facilitate free movement in the European Union. It doesn't mean that vaccination will become mandatory or be a prerequisite for such free movements. That is not the case. And also discrimination of people, that is not the goal, and that is not the case here. Non-discrimination is of utmost importance. And that is why not only vaccination certificates, but also test results and certificates of recovery are here in the scheme. And of course, the fundamental rights of data protection will be fully ensured as well. So the outline of this regulation is that, first of all, it's based on Article 21 of the treatment of the functioning of the European Union, that is free movement of EU citizens, and that means that the use of such certificates, for example, for continuity of care or for some private use, which could be envisaged by some member states, this is out of scope of the regulation. So the objective is to facilitate free movement, and a digital green certificate is the tool for that. And what is meant by digital green certificate is one of the 3 certificate. It's either a vaccination certificate or a test certificate or a certificate of recovery. It could look, for example, like this in its digital version. It has a QR code, including the relevant minimum data. Only key information is included. And every citizen who receives vaccination is entitled to receive a certificate for that vaccination. And the same basically applies to tests and recovery certificates. And the basic idea here is that this is not a new restriction to be imposed. That is totally not the case. It's about accepting certificates issued by other member states in case some certificates are required at the border. So if a member state waives free movement restrictions for vaccinated persons, for example, it is obliged to accept vaccination certificates issued by other member states. And according to the proposal, that must be also for EMA vaccines only. But the basic principle is that where member states accept their nationally issued certificates, in the same way, they must accept also certificates issued by other member states. Who is covered by the proposal? It's EU citizens and their family members, and also the incorporation into the EEA agreement, EEA nationals. There is also a way to support free movement with Switzerland, but that depends on a Commission decision and reciprocity. So it depends also on Swiss approach to this. And in addition, there is one more regulation proposed. That's kind of a twin regulation, the conditions under which nationals of third countries shall have the freedom to travel within the Union for a short period if they have the right to reside for this short period. The outline is such that there is, of course, a country of issuance, and the data which is used for generating the health certificates is there. So a digital certificate is generated by country A, and it's digitally signed using a private key. And then the public key corresponding to that private key is sent to the centralized infrastructure, the gateway. So it's important to note that this gateway does not contain any personally identifiable information. It's only for sharing some basic information required by the trust framework, such as the public keys linked to those signature certificates, private keys used for signing digital green certificates. Then this information, which is not containing any personal details, is fetched from time to time by all countries of verification, and that information is used for checking the validity of the certificates when they are presented by their holders.
Konstantin, one more minute, okay?
Yeah, I'm almost finished. So we are not building this on top of nothing. We have already guidelines. We have adopted the guidelines for the data sets and also this outline of the trust framework, the picture which I was showing you before. It's also an adopted e-health network guideline document. And also the Health Security Committee has adopted the data set for test certificates. We are doing collaboration with other international organizations. WHO is present in this meeting, and we are happy to see that what we offer to WHO, they are considering it, and we are able to support their work. And we are also with very much interest follow their work and analyzing its results. But also we are in dialogue with ICAO because these certificates are likely to be read by, for example, airlines, and we want to ensure that it's easy to do. The last point which I would like to make is that this regulation, it has a sunset clause. So when the pandemic is over, the regulation will, its application will cease. And the question is, do we build all this stuff just in vain? No, because when countries are preparing for this deployment of the digital green certificates, they are at the same time building infrastructure which could be reused for some other purposes, and at least two purposes are very clear. One of them is My Health at EU, so enabling health professionals to access data of foreign patients in their own language. In patient summary, in that infrastructure, there is also vaccination data and diagnosis data, etc. So it's more stable and sustainable solution for the longer run. And also the second point is the EU vaccination card. There is no decision yet to make one, but the feasibility study is ongoing, and any inputs which would be produced by member states when they are preparing for digital green certificates would be also useful for building a possible EU vaccination card. With that, I thank you and close. Over to you, Paul.
Thank you very much, Konstantin, for this very clear and important presentation. And although this is an EU initiative, I think it has very much international relevance, not only because of the international connection, but also the principles, the free movement, the types of data and certificates that are captured, the interoperability. But if in our international audience you would have specific questions how this might connect to what you are doing outside the European Union, please do post those questions in the Q&A. Happy to take them up with the panel. So now we will move to Ein Avixo for his view and his take on this. And Ein, knowing that you are very practically involved in this too, keen to hear your presentation for about 7 minutes. Over to you.
So it is good to follow from what Konstantin has just laid out. And I will bring a different view. Indeed, being a chief medical officer at one of the companies who is developing such smart vaccination certificates, and having been involved in the collaboration with the WHO even before the COVID era, I am wearing today two hats. So I'm talking from a tech company point of view, but I still in my heart am a medical professional and also a public health person. So I think that it's honest to start from laying out. So what has been my personal and also the Gartan's approach to this from the very start. So it has been really as a response to the COVID pandemic, rather than working on a document that would enable people to travel. Because I believe, and this is also what Gartan has been working in other domains, is that the trust is very difficult to create in certain point. It has been already emphasized a few times. It is really a process, and the governance, how those processes are managed, that in the end of the day make people to trust. So that when we talk about vaccinations and vaccination certificates, understanding that not only is important that the document is secure and immutable and everything, it is also important that the fact of vaccination did happen with authentic vaccine, and so coordination of the vaccine distribution of authentic vaccines, giving real-time situational awareness and collaboration between the different stakeholders. And if from that process, either for the first instance, because we know that with COVID, many vaccines require several vaccinations. It may be that another vaccination will take place in another location. So there are already, you can start evolving use cases which actually go beyond this just travel use case. And I think that the main question really is to still always, if people get into very technical discussions, be them IT technology or healthcare technology, is remind each other what is the why, and that helps to find a good answer to how we address this. And I have been in those discussions, and I remember the first a reason to have smart vaccination certificate was to empower citizens and continuity of care, either because you need this vaccination in another location, or now we know that there might be probably revaccination need. So this was the starting point. And then, of course, there is a need to, or you could make the case that you need to verify your status. WHO has been very clear saying that you can't verify immune status. What you can verify is potentially a fact that you have been vaccinated. And then you already get into the domain, are all vaccines the same, and that. And even more, I think that the public health monitoring and surveillance, which has been omitted, for practical purposes, I still believe personally that there is a value in it. And so all these use cases, as you can see, they have slightly different kind of benefit package, if you will. And also, if you think from the citizen's point of view, to share my health record with another healthcare professional, that's a very different situation than I'm about to share it with a random bodyguard. Well, the data content, again, is kind of in a different manner tilted, which means that I'm much more open to share much broader set of data with another healthcare professional, whereas on the border, the bodyguard really needs, perhaps, if at all, to know yes or no. So I think that this discussion has become a little bit too technical, or at least I know it has to be technical in order to be practical. But sometimes we need to understand, okay, we are dealing with some specific problem, and we should have maybe perspective to take also the other issues on table, but at least that we don't fight without clear kind of agreement. So this is a slide that I've showed a few times. This is something which tries to combine what the WHO, what the European Commission are trying to do, and then on the bottom there is something that companies like Gartam is trying to do, which is to provide some specific solution for a smart vaccination certificate. And I will finish by saying that our approach always has been to try to enable and focus vaccination campaigns effective by enabling different stakeholders to collaborate. And that is why we are working in order to increase the reliability of distribution chain. But that is then the end result, or okay, that's the beginning, and the end result would be then the smart vaccination certificate. And all in all, it somehow has to be part of the vaccination campaign management that all the governments are so worried about. So thank you for listening up. I hope we have a good discussion. And really, I hope that in the end of the day, what we are doing is building a service for the citizens that would empower them and would make them really in better control of the data in various situations, because that is how I understand smart. Thank you.
Thank you very much. Great slides, and also thank you very much for breaking the theme of collaboration between the various parties that are involved. And if time permits, I will come back to that, because this is certainly not something that is just one party and government top down, as the whole crisis has been something to manage also in partnership with many parties. Not simple to do, and certainly not simple to do in a situation of stress and uncertainty. So I'll come back to that. So thank you, Ein. We'll now go to our final third presenter, Vincent van Pelt. And I'm very keen to hear from Vincent more also about the trust framework and his experience from the Netherlands, but also participating in European collaboration. So Vincent, the floor is yours.
Thank you, Paul. Thank you, everybody, for inviting us. I will share my screen. Start. Right. Hopefully you can see my screen now.
Yeah, it's okay.
And I will put it in the presentation mode. Okay. What that works is, yeah. Okay. Yes. Well, thank you. We are, as the EOS Network subgroup on technical interoperability, working friendly and frantically on, well, getting this done, so to speak. So putting it all together is what I call it. And what we are putting together is all the different technical aspects that can help us in creating something that is safe, preserves privacy, prevents fraud, and is acceptable by everybody, because of course we take into account all the ethical, the societal, and the practical and the legal aspects of this certificate. And of course we try to create something that is that is born from a transparent process that uses the best experts in the world, and in that we also work together with the WHO and with ECDC and the HSC and other organizations who can help us to create in collaboration with each other this trust framework, so that everybody will be able to use the same foundation for trust, and the same way of working that was already shown by Konstantin will allow certificates from other countries to be accepted in our country. And that is a little bit of an introduction. And let's first look at what the certificate will look like as far as we have thought of at this point in time. Actually, the information that is in the paper or in the digital version is the same. And both also contain a QR code. And that QR code is like a sealed bit of information that tells you who this certificate is for, who has issued the certificate, so who is the responsible party, and the minimum information that you will also see on screen here. So the written form is also in the digital form. That's basically the idea. What we would like to do is to make the QR code in such a way that it is checkable whether it's valid. And the validity, normally you would check a public key by going to a European website and getting that information. But we have also decided that working offline is the best way to prevent any traffic that could relate to personal and private information as much as possible. Basically, this is another view of what has already been shown by Konstantin. So at the issuing side, you have either a vaccination or a negative test or a recovery from an infection. And each of those are valid for access to another country in the EU. There's a link to the holder, so because you have to be able to verify that the person who's showing you the certificate is who he says he is, so it is being identified. He is being identified at the issuing side, and in the QR code there's also a PKI, a private key for the responsible party. So at the verifying side, there are some questions that need to be answered. The border patrol person does not have to see any details because he's also in a workflow. He has to check the passport, and then he's also check the certificate, and he is not really interested in all the medical details. What he is interested in, or she of course, is this certificate linked to the holder? So that's something that you can check. Is the issuer sealed? Is the issuer trustworthy? And is the person okay for travel? And okay for travel means either vaccination or negative test or recovery. So actually, you don't have to know whether a person has been vaccinated or has had a negative test or has a recovery certificate. So that also detaches the actual medical data from the Border Patrol control. In the bottom, you will see that the public keys are sent to a national private key directory. Those are uploaded to an EU level private key directory, which is, by the way, also linked to a global PKD, for instance, by the WHO. And then the software that checks whether a person can pass uploads daily this list, EU PKD, which is simply a list of keys. And that's refreshed every day so that when some issuer is not trusted anymore, he will not be on the list. And so then that would stop the person from passing if the PKI is not in the list. So I hope this is enough information for how it works and what is in the certificate. I think this is an example because we started with the vaccination and now we've also added negative testing and recovery. But as an example, this is how the workflow would go. The citizen is identified by the vaccine provider, so he has to show who he is. Then the citizen is vaccinated. The information is registered usually in an immunization information system, and then the citizen can, at the same time or later, request a certificate when he wanted to travel. Then the certificate issuer sends a vaccination certificate, either paper or digital or both. And then whenever the need arises for travel, the citizen can show the certificate, and then the verifier checks whether the certificate is valid and whether the person who shows the certificate is the person who he says he is. So that's broadly how it works. And well, coming back to the different things that we have taken into account, I think what we have now is the realization of many different countries that if we work together in providing a very solid trust framework, that everybody can use that framework and benefit from it, and allow their citizens to at least give the opportunity for travel across the border without all the different problems that may arise if they are issued in a different language or any other things like that. It is something that is bottom-up collaboration, and I think that this will ensure that in the time when vaccinations will rise and the infections will go lower, that there will be room for travel. And well, if that is the case, and if all the legal considerations are done, then this would be the technical solution for a joint approach. Some other things, it's free of charge, so there is no costs involved. The digital green certificate does not preclude any other proofs. The member states who are receiving persons still have the opportunity when the need arises to have other restrictions. And that is something I think that's also, when you are going to travel, you would be likely to check if you go to a certain country, what the rules are at that point in time, because it shifts all the time. So although you have like a certificate for a certain amount of time, you always should check whether this is valid in this country. But basically, that should not arise very often, because science changes, but the science changes for all people. So usually the same rules are applied. I think that's it for the moment.
Yeah.
Thank you.
Thank you very much, Vincent. Another great presentation. I like very much also the fact that you show how it kind of works in procedural steps. That's an important part, and I think that holds generally, so can also be used across the world. Hopefully everybody will have more or less the same steps. Nevertheless, with all this clarification, there are also still important questions that will remain, and we are here to discuss them in the next 20 minutes or so. I remind the audience, if you are seeing on your screen this workshop screen, there is a Q&A a thing that is called Q&A, and that's where you can pose questions. We actually did get a question in that I think is quite relevant here, and I want immediately to pose that to Konstantin. Konstantin, I quote the question is, do you think it's prudent for the member states to establish their own vaccination certificates, considering the new EU proposal? Perhaps isn't it better to wait for an EU-wide solution so that also interoperability, the exchange of data, is easier? Konstantin, what's your answer to this?
I think every member state is basically interested in seeing its own vaccination certificates or other certificates compatible with the rest of the other implementations in Europe or also globally. But still, I believe that it's important to start implementing already now, even before we have all the final detailed specifications, simply because most of the complexity is lying in the ways to collect data, to set up systems for issuing the vaccination certificate. So all that work would be still important and needed. And, changing some minor details of how the QR code is combined together, etc. It's less an effort, which could be done a bit later.
Yeah, so it's like a co-development. And in fact, also it will take a while before the European Commission and the EU has both the technology in place for the interoperability and also the legal proposal has been adopted, isn't it? I mean, can you remind us of the timing, roughly, the expected timing?
Well, the goal is to launch the system by June. So, but it depends on many questions, including, of course, the adoption of the legal proposal. And we are doing all the technical work already, as Vincent was already mentioning. Technical specifications are underway and trying to understand.
As you have heard, also the collaboration with the member states and the e-health network on the trust framework was already started and of course will continue. Ein, a question that I want to, first of all, you to answer, perhaps the others also want to add to that. You stressed very much this is to be a collaborative effort, and indeed, of course, there are more parties involved in this if you talk about travel alone than just governments. There's the travel and transport companies, for example. So what do you see as some of the challenges? I mean, they must be concerned about, can I handle all this? Is it going to cost me a lot of money? Who's going to pay? Am I going to still have the possibility to have my flights running in time? Tell us something about what you think can come up.
Yeah, thank you, Paul. Indeed. And that's the reason why we, with the Estonian government, have decided pretty much, as Konstantin suggested, to develop a service to start issuing Estonian citizens vaccination certificates, and then also the other certificates in April. So we are really on the final line of that, and then practice through the whole workflow with the ferry operators. They say that they have maybe 30 minutes to let through 1,500 people, so that they can go the other side of the Finnish Gulf. And there are many questions that they have right now. And I believe that it is important to start implementing, maybe in pilot stage. Still, as a public health professional, I would say we don't know what eventually the use of these certificates will be in autumn, when everybody is declaring that by the end of July, Europe will be has herd immunity. So, my kind of concern now is that we are putting extremely big effort to build a very sophisticated PKI-based system, and then in the end we may little bit be with the same kind of situation as we have with the contact tracing apps, where we have the most secure privacy-preserving systems, but honestly they do not add that much of a value to the epidemiologists. So that is why I still urge to consider that if we are doing something, let's make it valuable beyond just this summer, which I know everybody wants to travel. So I want to go as well immediately.
Yeah, it's also quite interesting. Like also Konstantin mentioned, we are building perhaps an infrastructure here that can stay for a longer while, going digital across borders in health, or reinforcing that, in fact. But still, this is also very much a national kind of thing. Perhaps I see that we have still Martin here. Martin, do you know, is there a need to introduce anything special in terms of legislation nationally in Estonia?
In Estonia, no. It will all work out. I think currently the epicenter of the problem is still global, because it's a basic thing how one government can trust the other government, basically. Yeah.
That is a theme. I mean, it's very good that you mentioned the word trust again, because that does and will continue to come back. And is also what I want to ask Vincent. I mean, Vincent, you talked about kind of like the need procedure when you are traveling and you get to an airport, you've got an agent checking and those kind of things. But lots of people are also talking about private use of the vaccine certificate. So what are some of the positives and the negatives about private use?
I think that if you create any technology, so to speak, you will always have to take into account that this may be used for purposes that are not originally in the plan. However, we keep this in the back of our minds all the time, both the medical, the cross-border, and of course we also try to take into account the private use. Which is, of course, not in our line of work now, but we also keep into account all the other societal aspects and the possible questions that may arise. So in this case, how these certificates are going to be used is the responsibility of the member states. So that's national legislation. Whether they will allow this is also another question. So it is up to the discretion of the member state to say, well, for instance, in the Netherlands, we have some field labs where we have just had a concert and a football match, and just try to see what works. And that is basically what we're doing. We try to see what will work and how this will work out in a way that everybody will not go open up all the pubs and the restaurants willy-nilly. There is some regulation involved there as well, and those are, of course, are national regulations. If you're talking about the certificate, for instance, after you have received a negative test, you could use the same app, and there would be a venue where you would be allowed entry by just showing that app. And there's a good software that checks everything and does not show any information that is related to your health, but just says yes or no. Then that is something that could work, I think. But it has to be regulated within the countries, and of course we would like to think with them as well.
And for that, if I may continue, Vincent, on that point, I mean, there are quite a number of people that, of course, are worried about personal health data and data protection. Yeah. That has got everything to do with trust. And now you can say, okay, that's all neat and clear when you are traveling and you see a border control. But the cases that you're talking about, like private use, could involve that someone has to actually show their ID and tell who they are and a photo. And then you also see some information about health, the person who is checking that. So isn't that a sensitive situation?
It is sensitive. It is sensitive. What we have come up with is the fact that, or is the solution where you don't know whether somebody has been vaccinated or had a negative test or has recovered from COVID after a positive test. And in that sense, it shields you from the actual medical data. It just says yes or no. And I don't know how far you can take this, but if you would not use this, then you would not be able to have a solution for these kind of things that people would like to go somewhere. And then, well, how do you check that? If you make like sort of a regulation for all the software that's checking these apps or paper versions, we should have in place the rule that the information that is in the QR code cannot be stored or reused. It's just for entry and that's it. And those kind of rules should be in the legislation, I think, because you could potentially, even if you have like a security guard at the venue, these security organizations, they reuse personal information for any purpose, and they're just selling it. It's part of the business model. So we have to make sure that this does not happen. Well, in that case, I would trust that this would work fine, and that privacy will be preserved. Yeah.
You say that should be national legislation, or at least the National Data Protection Authority.
It is about privacy and not about cross-border issues. So yeah, Hein, you were raising your hand.
Yes. I wanted to drop in another piece of experience that Estonia has gathered over the last close to 20 years. Mm-hmm. So I think one thing that smart and digital can do, and which you cannot do that well in the analog world, is that you don't need to put your trust only in one instance or one document. The distributed information management means that, and this comes also to the helps to understand that if we have concerns that this data will be misused, it is equally important to monitor and follow how the data has been used. It's the saying among cyber criminals that you don't do cybercrime in Estonia because you get caught. And that is one thing, how you can balance the transparency with that of the efficiency and effectiveness of digital tools. So I think sometimes we try to protect the privacy, at the first instance, and then don't leverage its capabilities also kind of after the fact. So, and that is why this Estonian proposal to the WHO, and Martin knows everything about it, is very powerful, that enables to build services, not just verify documents.
Okay.
We are, of course, are still under this is still under this. Oh, sorry, Paul.
Sorry, in view of time, we don't have that much time, but please, short answer.
Very short answer, yes. I think in answer to your question, yes, we are also looking at all the different possibilities. We have rejected and accepted many during this process. So we're just still working on it. But I think on the track and trace, it has two sides. First of all, yes, you have like you can follow where the information went. But then the backside of that is, yes, you can follow where the information is gone. So that is in itself also something that is related to personal, to PII. So we have to weigh the pros and the cons in that sense, I think.
Thank you. Yeah. By the way, also, Hein, I would love to have asked you. You are doing this exercising. Are you also going to deal with quite complicated situations? People that are traveling around with vaccine certificates that perhaps are passing their validity because they have travel delays, or I don't know. I mean, I guess that I hope that all of you are thinking through also these complex situations. Is that true?
Yes, well, again, of course, we've tried to play through several scenarios, and that's also one thing that we have realized. We only know through the practice how the people will react to this, what are the workflows and all the other members within this ecosystem. So in that respect, I have full credit to the European Commission and the e-health network, because I know they have been working frantically. And so finding the balance of, okay, what is doable within a very short time frame. But at the same time, I still hope that people have in mind longer perspective. All this effort is only for these certificates to cross the border, and in autumn we really don't use them. That's maybe a little bit wasted effort, whereas making people to be able to use their health data in other instances. That is a noble goal.
Great. We are getting towards the end of the panel. I mean, we're talking here about trust, and there are so many dimensions in it. We talked a little bit about the technical and the procedural and the safeguards from data protection point of view. We did not yet really talk about the cybersecurity dimension. I don't think we will get to that. But in trust, always one of the most important things is definitely about communication. Communication, leadership, credibility, useful examples that people understand. So let me give to each of you the final word on what do you think is good communication around the vaccine certificates that can raise trust. What should happen? Just in a few words, what would you advise to do in the next few months? Ein, I start with you. What is good communication?
Yeah, we're very brief. We're taking some time already. I mean, we're also very practical. I think we need to really visualize what we're trying to do. Vincent did a very good job today here. So really having visual communication and taking time, giving people time to adjust to this and ask their questions. So it will be probably a process of 2 months at least before suspicious people gain trust in it. So take time, use simple visualizations, and that should work.
Okay, great. Vincent,
yeah, well, I think I completely agree with what Ein said. I think that if you have some simple but to the point information in a graphical form, then you can take out all the angles of people being mistrustful of what is in the QR code, what is this, and where are my data, and all these kind of things that we may expect, of course. And I think, so keep it simple. Stress the fact that this is good news because people can travel. I think that is already the first reaction of many people. They say, finally, I can go on a holiday, yippee. So yeah, why not? So let's stress that also, and not always go into the corner of the funny people, let's say, who are doubting everything, and try to regain that trust by being transparent. We have to be transparent. We have to be explaining this in a simple way. And we also have to make sure that this is not from Brussels. This is like a joint effort by all the member states. Yeah. And everybody agrees on this.
Thank you, Vincent. I think very wise words in that. Konstantin, of course, you are from Brussels, but still possibility to say now on the table. There's a lot of difficult.
It's more the framing, of course, yeah.
There's a lot of difficult work to happen. Something that you want to add on good communication around this? What would you say?
Well, many thanks to Ein and Vincent. Fully agree with their statements. And I believe we should also concentrate on refuting some existing myths. People saying that we are introducing new restrictions, which is totally not the case. Or people saying that vaccination becomes mandatory, which is totally not the case. So maybe trying to better explain these very basic facts very clearly would be important. And of course, I cannot say too much clearly because that's a real challenge. And we should concentrate on maybe the positive messages, as Vincent was already suggesting.
Yeah, promote the positive and debunk the negative.
So that's probably something that comes out, stressing the positive, be clear about what negative is and is not true, but also be honest and transparent about this. And I think also the previous panel ended on the note of that this is, of course, also a political process, and there's political leadership in this. Politicians can do a really good job in being clear and in their communication in this way that we just described. I very much want to thank the panel. It's a pity that it is only less than an hour, and there are so many other issues that may have to be discussed when we talk about trust. This is not the end of the story. Again, grateful to the e-Governance Academy, and also grateful for their leadership to have brought this to the table so soon. So with that, thank you to the panelists. Thank you also to the organizers, Merle and Hannes. I hand back to the organization for the final conclusions. Thank you.
Paul Timmers, thank you very much. Thank you for really very eloquently sharing this panel on the vaccine certificate. I think I've become so much more wiser about what it is and what it isn't. And I hope that all of our viewers have as well. In an attempt to sort of capture the wisdom, I think we don't have enough time, but perhaps I would share 4 points that resonated with me in hope that they can be useful. First, information and data that is accessible and is of quality can provide us with tools to treat the diseases better. And that's relevant both for COVID as well as for all the other diseases. I think Terje Peetso really put it very eloquently, almost in a hashtag language. Hashtag data saves lives. Second point from Kalle Killar, who said that today we may not have clear user cases of data exchange, which is necessary for the vaccine certificate yet. Although I very much hope that, for example, the Estonian case that we heard today, Estonia planning to go ahead with the vaccine certificate in April, will be a success story. And I think this is a really good and brilliant example of the public-private partnership between Guardtime and the government of Estonia, which is so much needed in finding solutions to this crisis. Third point, I think what resonates from the last panel, it is about proper communication and collaboration on basis of trust in each other. And as a way to increase that communication, I think last point, we need to improve digital and health literacy of people. And I very much hope that this online conversation on digital health, data exchange, and the vaccine certificate has helped a little bit to increase all of our literacy in these issues. Stay tuned about more to come on our eGovernance Academy Digital Transformation Talks series. Check us out, follow us in Twitter, Facebook, and other social media. For those who would like to review some of the panels, we shall make them available for you both on our website, on our webpage, as well as on the social media channels. And thank you. Thank you all the viewers who stayed with us for these 2 hours, and have a great continuation of the week. Bye.